Treatment of high blood pressure, hypertension. Treatment of high blood pressure. Changing your lifestyle can go a long way toward controlling high blood pressure. Specifically, the doctor will recommend measures. Eating a heart-healthy diet with less salt. Getting regular physical activity. Limiting the amount of alcohol you drink. Maintaining a healthy weight or losing weight if you're overweight or obese. But sometimes lifestyle changes aren't enough. In addition to diet and exercise, your doctor may recommend medication to lower your blood pressure. Your blood pressure treatment goal depends on how healthy you are. 1. Achieve your goal in treating high blood pressure. Your blood pressure treatment goal should be less than 130/80ths of a millimeter Hg when you're a healthy adult age 65 or older. You're a healthy adult younger than age 65 with a 10% or higher risk of developing cardiovascular disease in the next 10 years. Or you have chronic kidney disease, diabetes or coronary artery disease. Although 120/80ths of a millimeter Hg or lower is the ideal blood pressure goal. Of course, your doctors are unsure if you need treatment medications to reach that level. In particular, when you're age 65 or older, and use of medications produces lower systolic blood pressure, such as less than 130 millimeters Hg. So, your medications won't need to be changed unless they cause negative effects to your health or quality of life. The category of medication your doctor prescribes depends on your blood pressure measurements and your other medical problems. So, it's helpful if you work together with a team of medical professionals experienced in providing treatment for high blood pressure to develop an individualized treatment plan. 2. Medications to treatment of high blood pressure. 2.1. Thiazide diuretics. Diuretics, sometimes called water pills, that are medications that act on your kidneys to help your body eliminate sodium and water, reducing blood volume. In particular, thiazide diuretics are often the first, but not the only, choice in high blood pressure medications. Thiazide diuretics include chlorthalidone, hydrochlorothiazide, microzide, and others. When you're not taking a diuretic and your blood pressure remains high, please talk to your doctor about adding one or replacing a drug you currently take with a diuretic. What's more special, diuretics or calcium channel blockers may work better for people of African heritage and older people than do angiotensin-converting enzyme ACE inhibitors alone. Remember, a common side effect of diuretics is increased urination. 2.2 Angiotensin-converting enzyme ACE inhibitors. These medications, such as lisinopril, Zestril, benazepril, Latinsin, captopril, Capitan, and others. They help relax blood vessels by blocking the formation of a natural chemical that narrows blood vessels. In particular, people with chronic kidney disease may benefit from having an ACE inhibitor as one of their medications. 2.3 Angiotensin II receptor blockers, ARBs. These medications help relax blood vessels by blocking the action, not the formation, of a natural chemical that narrows blood vessels. ARBs include candesartan, Atacand, losartan, Cozar, and others. Also, people with chronic kidney disease may benefit from having an ARB as one of their medications. 2.4 Calcium channel blockers. These medications including amlodipine, Norvasc, diltiazem, Cardizem, Tiazac, others, and others. They help relax the muscles of your blood vessels. Meanwhile, some slow your heart rate. What's more special, calcium channel blockers may work better for older people and people of African heritage than do ACE inhibitors alone. Remember, grapefruit juice interacts with some calcium channel blockers. It increases blood levels of the drug and puts you at a higher risk of side effects. So, please talk to your doctor or pharmacist if you're concerned about interactions. 3. Additional medications sometimes used to treat high blood pressure. When you're having trouble reaching your blood pressure goal with combinations of the above medications, your doctor may prescribe 3.1 alpha blockers. These medications reduce nerve impulses to blood vessels, reducing the effects of natural chemicals that narrow blood vessels. Alpha blockers include doxazosin, Cardera, prazosin, Minipress, and others. 3.2 Alpha-beta blockers. In addition to reducing nerve impulses to blood vessels, alpha-beta blockers slow the heartbeat to reduce the amount of blood that must be pumped through the vessels. Alpha-beta blockers include carvedilol, Corig, and labetalol, Trandit. 3.3 Beta blockers. These medications reduce the workload on your heart and open your blood vessels, causing your heart to beat slower and with less force. Beta blockers include acebutolol, Sectrol, atenolol, Tenormin, and others. However, beta blockers aren't usually recommended as the only medication you're prescribed, but they may be effective when combined with other blood pressure medications. 3.4 Aldosterone antagonists. Examples are spironolactone aldactone and eplerenone Inspra. These drugs block the effect of a natural chemical that can lead to salt and fluid retention. However, they can contribute to high blood pressure. 3.5 Renin inhibitors. Aliskiren Tecturna slows down the production of renin, an enzyme produced by your kidneys that starts a chain of chemical steps that increases blood pressure. Moreover, aliskiren works by reducing the ability of renin to begin this process, due to a risk of serious complications, including stroke. You shouldn't take aliskiren with ACE inhibitors or ARBs. 3.6 Vasodilators. These medications, including hydralazine and minoxidil, they work directly on the muscles in the walls of your arteries, preventing the muscles from tightening and your arteries from narrowing. 3.7 Central acting agents. These medications prevent your brain from signaling your nervous system to increase your heart rate and narrow your blood vessels. Examples include clonidine, Catapris, Capve, guanfacine, Intuniv, Tenix, and methyldopa. To reduce the number of daily medication doses you need, your doctor may prescribe a combination of low-dose medications, rather than larger doses of one single drug. In fact, 2 or more blood pressure drugs often are more effective than one. Sometimes finding the most effective medication or combination of drugs is a matter of trial and error. Or refer in 247naturalhealth.com to all information about chronic disease. In particular, the simple exercises that lower high blood pressure. Right now, right where you're sitting, free solution. Link in the description. Thanks for watching. Do not forget like, share, and comment with us.